every other country, every other industrialized country has universal health care coverage. Yet we have huge gaps in coverage, right? Over like 46, 47 million people who lack insurance. And that's just that's just economic cost, right? You spend so much by getting less than other countries, right? Then there's the human cost, right? There's a recent study came out that over 45,000 people per year die because of lack of insurance. Think about it, 45,000 people per year. Every year, preventable. You know, when I was talking about the study earlier, this came out earlier this year in my class, I'm like, well, think about, you know, having 9/11, right? We lost over 3,000 people on that terrible day. And in reaction to that, to prevent some terrible event like that happening again, you know, we launched the wrong war. We'll get to that debate about how much we spent to prevent that, right? Trillions, 2 to 5 trillion by some estimates. And here we're talking about spending less than $1 trillion over 10 years to perhaps prevent 45,000 people dying every year. And so there's economic cost, human cost, and that's also, you can't really separate issues of, say, cost, access, and quality. They're all kind of intertwined. And so I think there's just a lack of awareness, I think, is a big problem at the political level, that this is a big problem, something has to be done. Doing nothing the way that some people, such as, you know, Congressman Brown, say, well, let's do nothing, let the system figure it out. I think it's unacceptable, and it's not really recognizing the nature of the problem and the magnitude of it.
And I think it's important to make a plug right now that, you know, this is a problem that affects everyone nationwide, this access, quality, cost. The American Census has released these community surveys. The last one they did was at the end of 2007, beginning of 2008. That survey found that there were around 100,000 people in Georgia District 10 that do not have health insurance. 100,000 people. 17,000 children don't have health insurance in this district. Now keep in mind that this is the beginning of 1998. What was the unemployment rate in 1998? It was much better than it is now, so we can be assured that those numbers have climbed, right? Dr. Priest, what would you, I want to go specifically in one direction with you because we just had this discussion. We drove here from Athens.
That's not the direction I want to
go. We all drove together, so we hashed it all out. But Dr. Priest, being an emergency room doctor involved in trauma care, tell me about that recent study that you referenced on the disparities in trauma care. This is very interesting.
Yeah, I think it's fascinating, actually. And this was just released in November 16th. Now, there are lots of ways that it's shown through these big studies that people who are uninsured do not have as good outcomes as people who are insured. Some of them are based on pretty obvious reasons. Race separates out as a separate factor. Clearly, African Americans, Hispanics, for a variety of different causative problems, would have much worse outcomes. The thing that's interesting about this particular study is it's a giant study out of Harvard, about 1 million people from the National Trauma Registry. I don't know, maybe some of you all have read about this. And they separated out all those different factors, and they separated out trauma scores, and separate from all these different things, race, socioeconomic status, what really separates out as a huge risk factor is lack of insurance. So the uninsured people, these are 18 to 30-year-olds with multiple trauma, with significant traumas. The mortality rate is almost double if you're uninsured. This is a fascinating concept. What it means is that there are subtle clues presented with this information. All the people who are trauma providers absolutely deny it, right? This is what naturally you do. You don't point the finger at yourself. You look elsewhere and say, it doesn't happen in our place. We do not discriminate on the basis of the non-insured. And for the most part, they're telling the truth, really. They're telling the truth that, at the outset at least, somebody who's on a stretcher, bleeding, and is semi-naked, and you don't know whether they have insurance or not. But what this is saying is this really fascinating thing is that there are subtle clues that somehow push through into, we talked about this on the way, that what could these clues be? But there are some subtle clues about who has insurance and who doesn't. And the sick thing about it, sick in the sense of sad, is that it affects their mortality. People are dying because of this. And this goes along with what Fossil was saying, that the 45,000 deaths, at least, this is probably 18,000 of those deaths are due to a lack of health insurance for trauma patients. Now, let me just take it where I wanted to go with your first question. Where I want to go with this first question is very few people...
Well, let me get in really quick. I think an interesting point to think about when considering the mortality of trauma care patients without insurance, and I think we kind of came to this agreement in the car ride, was that it must be the case that these people who don't have insurance are exhibiting signs of anxiety, right?
That's
They're in the emergency room thinking about the costs that are the bill that's going to come in the mail.
And that's a perfect segue. That's a perfect segue to where I'm going. Is very few people, I think, in this room can say that every day they go to work, they bankrupt somebody. I don't know, is there anybody that can say that? But I can say that. Every single day I go to work, I bankrupt somebody. And it drives me crazy. Okay, maybe he can do that. It drives me nuts. And let me just finish my point. Is that our this medical insurance thing, the way that the market forces have overlaid what supposedly is an altruistic medical system, has completely destroyed it. There's a really good study about this. The medical malpractice from 2007, the most recent statistics are 1 million people go bankrupt. About 2/3 of those people are from a single medical illness or injury, and 80% of those people had insurance. So the insurance, and the instructor, I'll shut up in just 1 second, and that is that the medical investigator said, our medical insurance system is like a fancy umbrella that melts in the rain.